I am Bill Pearson, Director of Boston Healthcare Fellowship. Welcome to our videocast. For our May BHF Zoom meeting, we invited Michale and Tracy Balboni to give an overview of their book, Hostility to Hospitality. Michale is a minister of Park Street Church in Boston, and Tracy is a radiation oncologist at the Dana-Farber Cancer Institute. We followed their overview with conversation about how we might exercise hospitality within the context of an inhospitable pandemic. We also discussed how COVID-19 has unveiled a system that has been inhospitable to patients all along, and what we might envision for more hospitable healthcare in a post-COVID-19 world.
I do want to say, just make a quick statement about the title of the book. It actually comes out of Henry Nouwen's book called Reaching Out, The Three Movements of the Spiritual Life, and where he talks about three movements throughout our spiritual life, and one of them includes hostility to hospitality. And, we see certainly in our own experience of the practice of medicine, saw this whole idea of hospitality, of welcoming in the stranger, as a biblical idea that certainly was central to the ideas that framed how hospitals, when they first arose within spiritual communities, so for example, within Western medicine, within Benedictine monasteries, et cetera, hospitality to the stranger was central as a biblical calling, and that should potentially this be a way that we could reconsider how the care of the sick could be framed today with this idea of hospitality. So this was my slide there are many acknowledgments that this is really the result of a work of a community. And this is this quotation from Henry Nouwen that hospitality means primarily the creation of free space where the strangers can enter and become a friend instead of an enemy. Hospitality is not to change people, but to offer them a space where change can take place. And so, why are we even talking about this movement from hostility to hospitality? And, I think I'm going to just be using some paintings, which was what we do sort of as a welcome into the book, to illustrate sort of a shift in medicine. And the shift in medicine is beautifully portrayed in these paintings. This first one by Sir Luke Fildes of the doctor. And as you can see, the doctor is in the home of a family. It's a family of a sick child. And in fact, the child here is the child of the painter of this painting. So Fildes is painting the death of his own child. You can see the image of himself in the back, standing with his hand on his wife, who's crying, praying on the table. And here, central to the image is the image of the physician caring for this dying child. And this, in my mind, is a picture of hospitality. Of course, the physician here has been welcomed into the home, so the hosts really are the family. But in a sense, he's bringing medicine into this place of intimacy with this family. And in the way that it's painted, certainly the fact that this artist chose to portray this setting of his own son's death, and the way that he portrays the physician just illustrates this wonderful connection, certainly love, even hope in the midst of this tragedy that's being brought simply by the presence of this doctor. And I think it's even portrayed in the light that you see that connects the physician with the dying young boy. But then, moving forward, we have an image like this one. This is John Collier's The Sentence of Death. And we have another dying individual, and we know that by the title of the painting, The Sentence of Death. And yet the setting is quite different. The setting is now the physician's office. And it's actually quite an affluent setting, really. We see the nice rug and his shiny shoes and nice desk. And of course, it's at least for that time, there's high technology involved. We see a microscope on the table. He has scientific books as well. But here, the connection between the physician and the patient are lost. And in particular to a setting where this young man is receiving news of his impending death, that connection is particularly stark. And And I think we all, this is sort of a painting in extremes, quite literally. But I think we all feel this. We feel the ways that our healthcare environment absorbs us in all kinds of things, whether technology, whether knowledge as pertained in our books, even the affluence that, the privilege that comes with the practice of healthcare and biomedicine, maybe not just in monetary forms, but even in the way that someone is held in esteem because of their role. All of that drives this division between the person that is caring for the sick and the sick person. And that's really kind of what this hostility is all about. It's beautifully sort of spoken of. This is Rabbi Heschel's statement at a AMA meeting years ago in 1963, where he says, the crisis in the doctor-patient relationship is part of the ominous, unhealthy, livid condition of human relations in our entire society, a spiritual malaria. It is not true that the diagnosis or the treatment of a patient comes about in a way completely unaffected by religious and philosophical commitments. The doctor's commitments are as much a part of its scientific knowledge and skill. So this, he's basically pointing out that it's false to believe that somehow a physician's beliefs about what is ultimately right and good and true and what brings about human purpose, meaning, and value somehow doesn't impact their practice of caring for the sick. And yet that's sort of the false narrative that we're living, that sort of drives a further division between the person caring for the sick and the sick person. But, so that's kind of a very brief overview of a context, but now we move into this. Now we move into COVID-19. And, I liken this image that, of course, we see that the person is protecting themselves in every way possible as far as the PPE, but we don't even see the patient. They're not even in this image. And how in the world do we do this? How do we, as it says in Matthew 25, Lord, when did we see you hungry and feed you, or thirsty and give you drink? And when did we see you a stranger and welcome you, or naked and clothe you? And when did we see you sick or in prison and visit you? And the king will answer them, truly I say to you, as you did it to one of the least of these brothers, you did it to me. How do we see people as well in this sort of setting? And what does truly being hospitable to someone look like, not only in the age of technology and high technology and knowledge and the culture of medicine, et cetera, but now in the setting of COVID-19. So the central premise of the book, I'm just going to try to briefly provide this overview, is that medicine suffers from this spiritual malaise, which really results from its disconnection from its prime origins. So the whole reason for medicine, of course, is based not in any empirical idea. Why do we care for the sick? Why don't we just let people die? I mean, it comes from a unprovable truth, which is that to care for people who are sick is a good. It is good to cure disease. It is a good to relieve people from suffering. And that is fundamentally connected to spiritual realities. And this malaise is it's not something that's just passive. I mean, they would have you believe, we just kind of push that out. And it's not, we're just allowing it to function elsewhere. It's not an active discrediting of spiritual realities, but it's not passive. It's active in the sense that it is a larger social force that pushes out spiritualities that counter its dominant spirituality. And that is the spirituality of immanence, meaning that all we are is what's around us. And so there is a spirituality that's being believed and embraced, and it pushes out all others. So disconnected from kind of these prime spiritual resources, which, because Western biomedicine, its culture arose primarily from Christianity, it's largely from the Christian tradition, other social forces have ballooned into it, economic, legal, bureaucratic, and that ultimately undermines the sort of the prime moving forces behind the practice of medicine, and most notably compassion and upholding the sick as Christ himself. And we argue that really it's these spiritual and religious traditions, and of course we're working within kind of what we've called an openly pluralist model. It is really the only social force that's capable of upholding compassionate care in the face of other forces, like the very powerful forces of economics, legal forces, and bureaucratic forces. And that leads us into this idea of structural pluralism, where you open space for spiritual traditions to really speak into and shape medical practice in order to foster a movement towards hospitality. So the book is divided into three parts. First, sort of empirical and sociological perspectives, then theological perspectives, and then considering ways we might restore hospitality to medicine. And I'm now going to turn it over to Michael so that he can take us through those factors.
So great to be with you, and it is a challenge to distill many words down to 15 minutes. So the book is something like 180,000 words, and we're trying to compact it down into a few hundred. But I think this particular slide captures a significant part of our diagnosis. In the middle is the doctor-patient relationship, the care of the patient, the one who is sick, and the caregiver. Those who are doctors and nurses is who we focus on within the book. In that relationship, so that everything that the doctor or the nurse or other clinician brings to the patient in order to care for them. And we would suggest to you that the driving, we use the language of social force, and we kind of did that on purpose because it partly comes out of sociology, but it's a blending. Use the word force because we're trying to blur into really a kind of a theological way of thinking, in which there are principalities and powers which lie within our culture. And are shaping our culture so that it affects and molds, or within the sociological language, it socializes people to think and to believe and to see things in certain ways. And so behind the sociological forces, which would be kind of the human level, there are spiritual forces, which the Bible uses the language of principalities and powers. I'm not going to unpack that, but I just want to acknowledge we don't unpack that in the book at all, because the book is really not written for a Christian audience, but it's compatible with that kind of theological way of thinking. Behind the chief or fundamental social force behind the care of the sick is hospitality and compassion. If we were to distill everything down to what medicine primarily is, it's that we are caring and receiving a sick person who is in their dignity, needs to be cared for, and if possible healed in whatever ways possible. And we as a society gather our resources as persons, build institutions, grow knowledge in order to enact or embody this fundamental belief that we are to care for this person made in the image of God. Now that language obviously isn't used in our secular culture at this point, but nevertheless, that's been our long history. It's been that fundamental belief that this sick person, even this elderly person, who in an evolutionary perspective perhaps should just be left behind, is not to be left behind. They're to be cared for, and we are use and should be willing to use vast amount of resources to care for them. So it's the heart that is this driving human energy that is desiring to animate the medical system in all that it has become. But it's not the only social force, and it's never been the only social force. What we see within Hippocratic medicine is that science and technology has always been, has been seen within the Hippocratic tradition as a key component to use knowledge in order to drive it to the care of the sick. And we've, of course, over the last 200 years, have seen this social force become, it's grown in its power and its abilities as we've witnessed its abilities to heal more diseases. But not only is science and technology a critical social force, but economics and finances has also always been a key component of the care of patients. It costs money. It costs a significant amount of resources. What we've seen, we have seen a shift, especially within Western and American medicine over the last 100 years, in which that economic piece has grown significantly in size in shaping the way people think, shaping their motivations, and how decisions are made not on an individual doctor-patient level, but on a macro level, on a systems level. The economic piece has become increasingly dominant as part of the rationality driving the entire health system. But then combined in this is a fourth social force, is the legal and bureaucratic social force. It's partly tied to a capitalistic system, but it has some level of independence in which usually capitalism and bureaucracy, they go hand in hand, but it's a slightly different sort of energy in which it is shaping and driving how medicine is being delivered, how it's conceptualized by patients as well as by clinicians and by the organizations that house them. And in the book, we suggest that these are the four primary social forces that are shaping the doctor-patient relationship as well as shaping medicine in its entire structures. And behind these social forces are organizations. They're behind the legal and bureaucratic. There are all kinds of organizations that drive the legal and bureaucratic. Behind the economic forces, there's all kinds of institutions that lie behind it, as well as with science and technology. And what we argue within the book is that within the hospitality and compassion, that chief driving force, we argue that the institutions or organizations that carry that social force have been over the last 100+ years have been eroded. So that while the other social forces have had organizations that have carried greater power within the structures of medicine, they've gotten bigger, stronger, more dominant. Whereas the organizations around hospitality and compassion, which have chiefly been religious organizations, religious institutions and denominations, they have been increasingly removed from the practice of medicine for a whole variety of reasons. Removed and have left. So it's not just that they've been removed such as a secular agenda. Religious communities have also in part removed themselves. But the effects have been that hospitality and compassion has become more difficult. Kind of another way of thinking of this is that the top three social forces, the legal, bureaucratic, the science and technology, and economic, are impersonal social forces. They're not about the person. Whereas hospitality and compassion is first and foremost centered on the person. And in the old system, hospitality and compassion was the central force, and the impersonal social forces served the person, because hospitality and compassion and the organizations that held that central logic of hospitality and compassion, they drove the system. They owned the system, and as they retreated, still many individuals held the same ideals, but that has been changing and shifting decade after decade after decade. And there's been also, and I got this from Bill actually kind of gave me this language in which within our own kind of within our own social imagination and within our own motivations and heart, the money and the privilege of science and technology and the kind of the powers of bureaucracy have been absorbed by many people within health organizations. They've taken them into the heart, and we might use the language of at least in part of idolatry. This is kind of the picture of the social forces that really are just incredibly powerful in shaping how people think, the imaginations that people have, and as we have been reflecting on this, it's been unclear to us whether anything could come along to change this. In fact, I was remembering that we had written this back at the end of 2017, and we wrote this. We said, what are the chances? What are the chances of such a cultural and professional turn away from problematic motivations caused by fear and money and ambition, or simply confusion that comes with the loss of vision? What are the chances of that changing? At the current moment, we wrote, chances appear slim, partly because there are so many hands in the money pot of medicine. The camouflaging of death remains a preeminent cultural power, and rival traditions too often trust in political means to adjudicate difference. Similarly, overwhelming social forces seem impenetrable and unstoppable. And that certainly has been has been kind of the way we've imagined this. There's a need and a call for change and for repentance and for the recapturing of the person to be at the center. But it's not been clear whether that's at all even plausible or possible. And I think what we want to do is to go into some discussion now, because maybe you came into this talk thinking you're going to get actual answers, and we don't have those answers. We told Bill we don't know, but he said, well, why don't you introduce the concepts and then we can go from there. And this is COVID-19. COVID-19 has struck a blow to the entire to all the social forces. The economic system is in significant shaking. Science and technology is obviously working overdrive on the problem of COVID-19, and it remains a question of what's going to happen, and how quickly it will happen, and how much, and whether medicine will celebrate itself in the end of solving this problem, and whether that will continue the scientific narrative of our culture of science being preeminent, or whether something else will happen. And the whole legal and bureaucratic system is very rapidly, we're seeing certain parts of medicine rapidly change that were entrenched and unstopped. Telemedicine, for example. Nothing could bring that about, and all of a sudden within a week or two, we have telemedicine. So we're seeing COVID-19 rapidly affect the social forces. And so it's a moment of, we're entering into a very unusual time that's centuries really in the making, perhaps. And there's this major question of, will things go back to the way they were? Or will this really drag on so that these social forces become permanently changed? And then the question is, what's going to happen? What are they going to change to? And will there be a repentance of the heart to put the patient first? And I think that's the question we're all kind of waiting on. It seems to me at the very least, we have to become more a people of prayer, because what is humanly impossible is now happening. And it seems that to me this is the hand of God that's working. It's a very unique moment. God can just, in it, I was thinking about it earlier today, Nebuchadnezzar, the Babylonian Empire, unstoppable kingdom. And then the hand of God comes and says, many, many tekel parson, I've come and weighed you and found you wanting. And that night, the whole kingdom shook and was taken out. Are we kind of facing that same sort of moment? And what is the Lord going to do, and what might he do with us? So with that, I think we'll stop, and we'll stop sharing, and we'll turn it back over to Bill to see what step he wants to take.
For those who joined, we had a really wonderful conversation in breakouts and then together about how to extend hospitality to patients in the COVID-19 world. There were wonderful ideas about putting life stories on the EMR, letting patients drive the agenda of the conversation, of providing spiritual care on a more regular basis, and for the hunger that there is among patients around questions of faith. One physician talked about how telemedicine put her in a disposition of moving towards the patients, going into patient homes, it being more about going to them instead of expecting the patient to always come to us. We talked about the need for care for staff and for structures of care that included generating structures for prayer together. There were many wonderful comments and ideas, but probably the most enjoyable one was a poem that will credit Katie and Nathan and Xavier, which went like this. Telemedicine, here to stay. Nursing homes may go away. Essential workers rock the day. Social forces kept at bay. God is king, anyway.